again. Now I'm going to speak about the next dimension in my theoretical model on transcultural caring dynamics in nursing and healthcare. And this one is a focus on the transcultural context. I said a little bit about it when I gave the overview of the whole model, but I wanted to spend a little bit of time about understanding the nature of our relationship with our patients within understanding of the idea of personhood and also individualism, family, community, and then beginning to understand the context within which we live and we work. Because I think this element becomes really important from the standpoint of the issues that are occurring in nursing today, which happens to be, as we all have heard often when we're working, for example, in hospitals, we'll say, well, everything's the bottom line today. So we know that, for example, economics becomes a very important concept. So it is important for us to understand we ourselves as cultural beings and the context within which we live and work. And so I'm going to spend a little bit of time talking about these notions, about our individual identities. And actually what they say in anthropology today, we don't just have one identity. We have multiple identities. We have identities as a human being. We have identities as a professional individual. We have identities within the context of an ethnic group. For example, if we're, Hispanic or, even Italian culture or whatever culture. And so we have what is now being communicated in anthropology is pan-identity. So rather than saying this person is Hispanic, this person may be Hispanic, but this person also is from a particular family, and this person has a personal culture, and so we just begin to look at something beyond just identifying somebody as one thing, and subsequently similar to ourselves. We are not one thing. We are actually multicultural beings. We are from, as I mentioned, we are individuals. We are from a familial culture, an ethnic culture, a professional culture, and if we're working somewhere, we're from an organizational culture, such as Florida Atlantic University. We have a particular organizational culture here, and if we're in the College of Nursing at FAU, we have a foundational caring culture, which is the essence of our curriculum and the essence of our being at FAU. So this notion of identifying ourselves in multiple identities is very important, because then it prevents us from sometimes becoming ethnocentric. It helps us to see that we're broader than that. And so within this idea of transcultural context, we bring a lot of different and diverse values, beliefs, attitudes, and subsequently behaviors to relationships. And so we have to recognize that when we are trying to understand the other, we are trying to understand them also as having these multiple identities. And within the context, I've identified the fact that we have, I'll say a hospital, for example, because most of us have either worked in them or are going to be working in them. So a hospital has a political culture, which means that it has a system of governance, that has a chief executive officer, chief nursing officer, chief financial officer. So it has a political culture in relationship to understanding the meaning of governance in a particular institution. At the same time, we can understand that it has an economic structure, which means fundamentally that we're dealing with resource exchange. From an anthropological perspective, the idea of economics is the theory of exchange. For example, you as a nurse who is working and receiving a paycheck, it's an exchange phenomenon. We are getting paid for the work that we do. So rather than seeing economics as a totally negative concept, we can begin to see it as something that is part of an institution, or if we're looking at a family culture, we have a budget that we have to follow in a family. Otherwise, we're going outside of the budget, going into debt and all that kind of thing. So it's a similar situation when we're dealing with the context of economics in a healthcare setting. And so the meaning of economics, for example, because I've studied this a lot since I received my doctorate, looking at economic caring, but how do we look at concepts like goods? What are the things that are part of our culture? Money, how is money exchanged? For example, in hospitals, we have the exchange insurance companies. So if for example, when we have a treatment tray, there's a code on it. We might scan that code. That code goes to the desk at the front, then it goes down to the finance office, then it goes to the insurance company, and that is how the insurers get paid and how they charge the hospital for what they're going to get paid. So this idea of this exchange of money, and then the other is services. And I always look at nursing as beyond services, but we are providing a service. So economics is the exchange of goods, money, and service, or services. But I also look at caring as a resource. So what do we mean by caring? Caring to me, in an economic sense, is a value-added concept. So subsequently, we are looking at when we care for someone and we facilitate their health and healing and well-being, there is a value-added notion to that. They feel better. There is patient satisfaction. And as all of you know who are working in hospitals, we have to do these surveys all the time that have to do with patient satisfaction. So patient satisfaction is a part of a value-added concept, and it definitely relates to caring. And then the other idea, looking at caring as an economic resource, is looking at it within the idea of education. When we educate our patient, they are becoming more knowledgeable about what is happening and going on in their health care, so that they can care for themselves better. And when we're critiqued quite a bit in hospitals that patients go home and then now the insurance companies will penalize us if a patient comes back in the hospital within 30 days. So we want to educate patients so that they are knowledgeable enough about their own health care that they don't have to keep coming back into the hospital to receive care for the same health care problem. And then the other area that I look at as a value-added concept in caring, as an economic concept, is how we actually communicate and how we use our knowledge. As you know, we have different levels of preparation for nurses, and we have people who are prepared within a 2-year nursing program, a baccalaureate program, multiple master's programs, a Doctor of Nursing Science program, and a PhD, which is the research dimension of our educational process. So how do we use our knowledge within the notion of caring? And it all has an economic foundation. It has a resource exchange perspective. So what I'm sharing with you is, rather than seeing economics as a potential negative concept, how can we begin to look at it as a positive element, and how can we share in that? And how can we communicate our knowledge about economics with chief executive officers or chief financial officers who might want to appease maybe a physician request as opposed to a nursing request? And those of us who have been nurse managers, who are going to begin to be nurse managers, then how do we have some degree of understanding about this context and this economic context, which is very significant in our institutional cultures and our work environments today. And so also within context, we have educational context that I spoke about a little bit, that we have formal education, but we also have constant continuing education. And we're always continuing our education when we're relating to another person to help them understand what is going on and help them to have facilitate healing, well-being, and if it's in a end-of-life situation, how do we help the patient and the family, with this idea of dying. So education becomes very important from formal level to the, what I wouldn't even call it informal, but this idea of health, healing, and peaceful death. And the other concept in the healthcare industry or healthcare environment is the legal. All of you as nurses recognize that we're all responsible for standards of practice, rules and regulations. We have many of them from our licensing, as soon as we're licensed to practice. We have multiple legal responsibilities that are social as well, relative to ourselves as professional nurses. And so whenever you're asked in a hospital to participate in standards of practice or some kind of regulation, then you know that you are engaged in a legal context. And now we could have formal legal issues, if there was a violation of patient safety, and one would have to be penalized for some reason, or even outside the institutional system where they might have to go to court. But we hope that doesn't happen. But certainly legal is a very important part of our practice. And so when we're sharing with patients, one of the elements is patient safety. So if we violate patient safety, then we can be liable for, not the best professional outcome, from that particular experience. And then the other that is critically important today, when we're looking at context, we're looking at technology. And as we know that technology has both the direct relationship with our patient, for example, in intensive care, where we're using complex technologies to sustain life, whether that's in neonatal intensive or regular intensive care or step down, and so, or just on a regular unit where we might be using some kind of technology to support the well-being of the patient. So technology is another contextual element that becomes critically important for our care of the patient. Now, in our modern age, we have computer technology at practically in all contemporary hospitals today. We have computers at the bedside. If they're not at the bedside, they're close to it. And we have social media. We're calling ourselves now this generation that is really focused on social media. And we're looking at, even in nursing, now looking at virtual presence or virtual relationships. How do we educate patients from in terms of virtual communities? I have a colleague I work with in Australia who has set up a program for cardiac issues and comorbid with diabetes, and with different cultures such as Chinese, Taiwanese, Aboriginal culture in Australia, and Australian ethnic cultures. There's multiple cultures in Australia, like there is in practically all Western nations. But her work is looking at how can she create social media to facilitate health and well-being. And so what she's done is she's been able to facilitate, for example, patient-to-patient education. So if one patient has diabetes and they have a special way of developing a diet, that diet, which is consistent with like a diabetic diet, he or she can share that with another patient. So they're all interconnected. And her name is Dr. Wu, Jo Wu, and she won a bronze medal for research at the European Society for Patient-Centered Care last year for this amazing research using social media, text messaging, all kinds of different ways of communicating. And so we can see that many hospitals today, even in our own nation, we use handheld computer devices. Many times patients now can have our phone number on a unit, and if there's a need, the patient can call the nurse who's assigned to the patient. So technology is increasingly more important, not only for sustaining life, but at the same time for communication. And we are in the communication age, so we see more and more complex technologies all the time. And here I am talking to you on YouTube, which is a complex technology. So I'm able to share this particular theory with you and help you to see how important this context, this cultural context, these multiple cultural contexts are to the way in which we care for patients. And so another area in here is looking at symbols. Like symbols have to do with meaning. So various symbolic interaction. For example, as a nurse, if we come into a patient's room and we're in the ICU and the cardiac monitor is ringing off, and we only look at the monitor, and we don't even ask the patient how they're feeling or look at them. We only look at the monitor. That is like a symbolic interaction. So this patient understands that they're not very important often if we're only looking at the technical element of their care and not looking at them as a human being. And then, so that's kind of one way of looking at symbolic interaction or comportment. The idea of how do we look when we approach a patient. If we're, perhaps our uniform is, and it's understandable, our uniform could become soiled, but for the most part we want to present ourselves in a very professional way to our patients, and certainly not use foul language or various other kinds of things that we might have thought about or whatever. And so comportment becomes extremely important, and that's all part of symbolic interaction or communication. And then one of the other elements is ritual. Ritual is a very significant concept in culture because it has to do with what rituals do we use when we're engaging with the other. One of the major rituals that we might think about in nursing is the stethoscope. Years ago, when I was a young nurse, we used to wear a nurse's cap. And of course that identified that you were a professional nurse, and if you had a black band on it, it meant that you were a registered nurse. And however, over many years, we've decided that we're not going to wear caps anymore. However, now we actually wear a stethoscope, and we usually wear it around our neck. So it becomes part of a ritual, and we have to recognize that that is an identifier for us as a professional nurse. And so there are many rituals that we use in nursing or in education or in different family life that become significant for a particular family. Look at, soon we're going to be celebrating Thanksgiving. So we have the ritual of having a Thanksgiving dinner, generally with a turkey and with all the trimmings, and we always try to have family close by. And that becomes our annual ritual. And soon we have the holiday season, and we have different rituals associated with the holiday season. So all of these are part of our cultural context, and whether they be within our profession or whether they be within the nation at large or different nations. And so each nation also has its own rituals. Sometimes we don't understand them, but we as transcultural nurses, we do try through our education and continuing education to try to understand these various symbols and rituals that are associated with different culture groups. So all of these play a role in how we can best provide transcultural caring to our patients, whether it be in the hospital, in the home, in a community setting, or at policy-making level. You know, I just came back from the American Academy of Nursing, which is really focused on how do we create national policy for the improvement of nursing practice and for the improvement of healthcare within our own nation. So all of these contexts now are becoming increasingly more to our enlightenment, so that we can not be perhaps frightened by some of these elements, you know, that we have to deal with, but at the same time embrace them, so that through continuing ed, that we can have what we would call our own satisfaction within the caring process. And as many of you know, sometimes we have such a great turnover in different institutions precisely because people, the context, we tend not to understand these political and economic, technical, and legal environments that we're a part of. So this dimension becomes extremely important again for the purposes of providing transcultural caring.